Uh, I think I'm very kind nurse, so I try to be very kind and at the same time very polite to the patients and then their family members. So, for example, if there is a patient who needs explanation in details, I just keep trying until they find it's satisfactory. So I do not mind just repeating myself to make them feel comfortable. And for the open-minded, as I'm foreign nurses, I'm quite open to all the cultures, and every culture is new to me. So what I'm trying to do is first I listen to people's voice first, and then I ask question if there is any problem or if there is anything I don't understand. So I try to be staying positive, open-minded, and for the positive way, yeah, that's one thing I try to keep myself being positive. Otherwise, the life is gonna be miserable. And for I don't know how I can give you the example for that, but. Mm, at the moment, I don't have a work, but I'm trying to be very positive and I'm quite confident that I can get a job and try to stay in that way so that I I I can be happy. But there are some patients who has lots of family coming visiting during their stay. I'm quite happy with them, and I think they are really good to support the patients. So I just try to them to be involved in the care if it's possible. The best thing to preventing the bladder cancer keep coming back is to stop smoking. And the patient was a smoker, and normally the smokers is quite difficult to make their mind to stop smoking. But I had a good communication with one patient and explained all the benefits when he stopped smoking, and it worked, and I was really happy. Actually, he was the only patient who was successful to quitting smoking. And I provided all the smoking cessation program and referred him to the community smoking cessation programs, and it worked really well. I had a kind of nurse-led clinic, so I had to start from the education, getting the consent, assessment, and then making decision. The whole procedure I had to do this. So education is really important so that the patient can understand what I'm gonna do for them. And another thing, I need to assess if they are following my cares. So I'm quite good with those education session and when I had a patient in the ward, there was a patient who was scheduled for the procedure or operation. So we had a whole getting ready for the operation, and then it got cancelled in the afternoon. So the patient was starving from the midnight, everything, and the patient was quite upset. So I approached the patient and then explained the situation and then explained what will happen next. And then I provided all the options the patient can have, like a food or other options for the nursing care or medical cares. And actually, it happens quite often in the ward. So the patients normally accept it very well. I used to do like a team leader time to time, and I allocate the patients to the nurses. And one of the nurses was not happy with the patient's allocation, and she approached me about that issue and then complained about it. So I accepted that, and then I negotiate, and then I try to reallocate patients by the way discussion with all nurses. So it worked well, but if it didn't work well, I would go to the talk to the manager. For me, I think normally when I start the new job, right, at least 3 weeks, 4 weeks, I just try to observe things first and then learn about the people I work with. So once I get to know the situation, environment, and people, I adjust myself to that new system, new environment. Yes. yeah, before I make any decision or get to the conclusion, I think a lot and then try to get all the options I can take, and then I make a decision. Uh, I'm kind of person who follows the rules. So if there is a rules already set up, I really stick to that. So if actually there was no example that the doctor or any other nurses managers approached me and saying you did the thing in appropriate way. I think it's because I always stick to the rules. But if somebody talk to me and then ask me to do something in a different way, I'm quite open-minded to do that way. If I find it more efficient way, I'm quite happy. But if it's against the rule I'm stick to, hey, I would express myself. Through my work, day by day, there are things I'm not really sure, or there are things I find it I need more knowledge or experience, and then try I try to get more information or knowledge by myself first, and then if I think it's not enough, I would ask some help from manager or somewhere else.